Demo 8.1. The infratemporal fossa is inferior and deep to the zygomatic arch. It's bounded laterally by the ramus of the mandible, anteriorly by the maxilla, medially by the lateral pterygoid plate, superiorly by the greater wing of the sphenoid bone, and posteriorly by the styloid process, the tympanic plate, and the mastoid process, which has been cut off in this photo, but you can see here. Contents of the infratemporal fossa include V3 and its associated branches, such as the lingual nerve, seen here, and the inferior alveolar nerve. Here, we can see that it's piercing the mandibular fossa. We also have the chorda tympani, branch of cranial nerve 7, and the otic ganglion, which are undecipherable in this image. Arterially, we have the maxillary artery and its associated branches. And muscle-wise, we have the inferior aspect of the temporalis muscle, the medial pterygoid muscle, and the lateral pterygoid muscle. Next up, muscles of mastication. There are 4 major muscles of mastication, all of which are innervated by the branches of V3. First, we have the temporalis muscle, outlined here in green. It attaches broadly to the temporal fossa and the coronoid process of the mandible, which would be deep here. Upon contraction, the temporalis muscle aids in elevation of the mandible, as well as retraction, or posterior projection of the mandible. Then we have the masseter, shown here in pink. The masseter attaches to the zygomatic arch as well as the lateral aspect of the mandibular angle. When it contracts, it elevates the mandible and contributes minimally to protrusion or anterior projection of the mandible. Then we have the lateral pterygoid muscle, shown here in gray. The lateral pterygoid has a superior and an inferior head, both of which are attaching to the joint capsule and disc of the TMJ. Upon contraction, the lateral pterygoid aids in protrusion, anterior projection of the mandible, as well as increasing the range of motion of the TMJ joint. We can see that over here. We have the superior belly and the inferior belly. As they contract, they're pulling the mandibular condyle out of the mandibular fossa, allowing for a greater increased range of motion. Lastly, we have the medial pterygoid muscle, shown here in blue. It also has 2 heads, which insert on the medial aspect of the mandibular angle. Upon contraction, it aids in elevation of the mandible as well as protrusion of the mandible.